Hey everyone, and welcome to today's Explainer. We are diving straight into something absolutely crucial for anyone in healthcare, mastering the art of painting a defensive, unambiguous clinical picture in the objective section of your SOAP notes. You know, if you're a clinician, a medical coder, or a clinical documentation integrity specialist, you already know the drill. The difference between a totally bulletproof medical record and a vague, risky one? Well, it almost always comes down to exactly how we document what we observe. So let's kick things off with a pretty tough question about some of those common documentation shortcuts we're all guilty of. Are you still writing things like VS stable or labs normal in your charts? Honestly, it's a super common habit, right? But shortcuts like these might actually be jeopardizing your clinical records. Today, we're going to look at exactly why these vague phrases fall short of clinical documentation standards, and more importantly, how you can fix them. All right, here is our roadmap for the Explainer today. We'll be covering decoding objective data, vitals and general assessment, physical exam formatting models, the head-to-toe flow, and finally, documenting diagnostic results. Let's get right into it. Section 1, Decoding Objective Data, the 4 pillars. Okay, so the absolute most important takeaway here is that objective information is what you or others can strictly observe. It's built on these 4 foundational pillars. Unlike the subjective section, which is basically the story the patient is telling you, the objective section is 100% rooted in measurable, verifiable facts. It logically flows from the subjective history and reflects your differential diagnosis. Literally everything you document here has to be a direct observation. That means the vital signs taken by the nurse, your overall general assessment of the patient, the specific physical exam findings, and of course the concrete results from any laboratory or diagnostic studies. Section 2, Vitals and General Assessment, Setting the Scene. Just look at this stark difference here. Vague vital signs, like writing VS stable or VS within normal limits, really leave a dangerous gap in your documentation. But when you write out the actual exact values, you're doing 2 really critical things. First off, you provide an unambiguous baseline for this specific encounter. And second, you allow anyone else reading the note, whether that's a consulting provider, an auditor, or a CDI specialist, to make their own independent clinical interpretations of those vitals. You're giving them the hard data, not just your subjective summary that things were stable. And beyond just the numbers, your general assessment is what paints the real context of the encounter. This is your big chance to document the patient's acuity the second you walk into the room. I mean, are they in acute distress? Are they alert and oriented? Maybe they appear markedly older than their stated age. Are they sitting up comfortably, or are they literally curled in a fetal position, grimacing in pain? Documenting these precise observations provides this incredibly vital clinical snapshot that numbers alone just can't capture. Plus, it powerfully reinforces the medical necessity for the exact level of care you're providing. Section 3, Physical Exam Formatting Models, the Showdown. So you essentially have 2 ways to format this. Whether you use a narrative paragraph format or specific system headings largely depends on your facility and your EMR software. But honestly, the systems headings format is generally the preferred way to go in modern documentation. Why? Well, it's super simple. It allows readers to just jump quickly to the system related to the chief complaint. For example, if a patient comes in with abdominal pain, a consultant specialist can just immediately scan down to the abdomen or gastrointestinal heading. They don't have to slog through a dense, continuous paragraph just to find the pertinent positive and negative findings. It's a huge time saver. Now, this quote, directly from the documentation guidelines, is absolutely vital for compliance. Pay attention to this one. If you're using the systems heading format, never, ever write not examined under a heading. Simply omit the unexamined system entirely from your note. Seriously, if you include a heading like neurological, only to write not examined right next to it, you're just cluttering the digital footprint. And worse, that can actually trigger unnecessary scrutiny during an audit. Just leave it out. Take a look at this actual EMR snapshot. It brilliantly illustrates the concept in practice. Notice how incredibly clean and scannable the system's headings format is when pertinent positives and negatives are recorded properly. You can see how the provider has clearly separated general, HENT, neck, respiratory, and so on. It just creates a much more efficient reading experience for the next healthcare professional who opens up this chart. Section 4, the head-to-toe flow, standardizing the sequence. Now, we all know a live patient exam can be a bit chaotic, or you might need to adapt on the fly. Like maybe you examine a really painful area last, just to keep the patient comfortable, right? But the documentation of that exam, that has to remain strictly disciplined. This rigid, head-to-toe sequential flow is exactly what readers of the medical record expect to see, completely regardless of the actual order you performed the physical maneuvers in the room. The big takeaway here is that documenting out of order creates major confusion. Conforming to this standard, predictable download flow completely prevents ambiguity, and it saves so much time for consulting providers reviewing your notes because they know exactly where to look for specific findings. Sticking to this universally recognized structure basically builds a professional, highly organized, and very defensible digital footprint, the kind that holds up beautifully under CDI review or external audits. Section 5. Documenting diagnostic results. Exact values matter. Okay, much like what we talked about with vital signs earlier, vague laboratory phrasing is a massive compliance risk. Instead of writing something like CBC is normal or WNL, you absolutely must cite the exact numerical values. So if a complete blood count is run, document the exact white blood cell count, the hemoglobin, and the hematocrit. Why do we do this? Because it establishes a concrete baseline for the patient's record. Think about it. If that patient returns 2 days later, the next provider shouldn't have to go hunting through the EMR to figure out what normal meant 2 days ago. The exact baseline values are right there, perfectly preserved in your note. And when you're documenting diagnostic imaging, there's a huge compliance difference between relying on another professional's interpretation and actually doing it yourself. You have to clearly distinguish this. If you're relying on the radiologist's official interpretation, state that clearly, like X-ray negative for fracture per Dr. Al-Zafid. But if you performed an in-office intervention where you personally reviewed those films right there in the clinic, you must explicitly state, I personally reviewed the X-rays and do not see any fracture. That proves your direct clinical work and thought process, which is totally essential for accurate coding, billing, and clinical validity. Oh, and the exact same rule applies to therapeutic in-office interventions. If you personally apply a knee immobilizer, place a splint, or even provide crutch training, you have to explicitly detail those exact actions in the objective section to capture the full scope of your clinical work. Don't leave your hard work out of the chart. Building a rock-solid objective section definitely takes some discipline, but at the end of the day, it protects you, it informs your colleagues, and it ensures the absolute highest standard of patient care. So ask yourself, if your notes were audited tomorrow, would your objective data really stand on its own? Thank you so much for joining me today to master these concepts. Please like, share, subscribe to Decode Healthcare with Harshal.